You may have noted in the last module that two of the Health Center program requirements speak directly to aspects of board governance. They are board authority and board composition. These are especially important requirements because they tie back to a fundamental aspect of the Health Center program. Health centers are patient-directed. Health centers are required to have a patient majority board that represents the community. That means that patients are directing the health centers, which is pretty unique and incredible. Before we dig into the requirements, it is critical to note that overall health center board roles and responsibilities extend beyond HRSA program compliance, which we will address in a moment. Your health center's governing board must meet very specific composition requirements. First, your board must be 9 to 25 members in size and majority, at least 51% of whom are patients of the health center. The patient board members, as a group, must be demographically representative of the people served by your health center. The non-patient board members must also represent the community and be selected for their relevant skills or expertise, such as a background in local government, finance, law, or social service agencies within the community. No more than half of the non-patient board members may derive more than 10% of their income from the healthcare industry. And no board member may be an employee of the health center or an immediate family member of a health center employee. If you serve a special population, you will also need representatives from each group served. Finally, your health center's bylaws must outline the process for selecting and removing board members. There are a few exceptions to these board composition requirements for specific types of health centers, such as public entities or tribal or urban Indian organizations. Please review Chapter 20 of the Health Center Program Compliance Manual carefully and consider how your health center will maintain compliance with the requirements. Many boards have a matrix or system for tracking board composition requirements. Tips can be found in NAC's Governance Guide for Health Center Boards, Chapter 2. Your health center's board must also fulfill specific authorities that should be detailed in your bylaws. These authorities include monthly board meetings with quorum, selection, evaluation, and termination of the CEO, approving the health center program annual budget and applications to HRSA, approving sites, hours of operations, and services, evaluating health center performance, establishing, adopting, and evaluating health center policies, conducting long-range strategic planning at least every 3 years, and ensuring the health center operates in compliance with federal, state, and local laws and regulations. Your board of directors collectively fulfills these authorities, and no other individual, entity, or committee can have authority or veto power over the board with regard to these authorities. Fulfillment of these authorities at meetings must be documented in your board's minutes. It can be helpful for all board members to review Chapter 19 of the Health Center Program Compliance Manual to ensure familiarity with these requirements. We've defined who must be on the board and what some of the specific required board authorities are under the Health Center program. But what is the board's overall governance role? The board's roles fall under 3 main categories: strategy, oversight and policy, and functioning. Strategy includes strategic planning and thinking, implementation of strategic plans, and recruitment and education of strategic new board members. Oversight and policy include approval and update of bylaws, oversight and approval of health center policies, oversight of the health center's CEO, financial oversight, and oversight of quality of care. Functioning includes ensuring productive board meetings, effectively using committees, and creating positive board culture. Finally, it is important to point out that the relationship between your health center's board and its CEO is very important, as they share responsibility for the success and sustainability of the health center. The CEO is the only employee that is directly hired by and directly reports to the board of directors. In fact, It is a HRSA Health Center program requirement that your health center CEO be directly employed by the health center, report to the board, and oversee health center activities solely on behalf of the board. The CEO then fulfills and/or delegates day-to-day operational duties to staff, while the board fulfills that high-level oversight function. It is good practice for your board to have a partnership with the CEO that is based on respect, open communication, shared strategic focus, and mutual accountability.